It's just one.
All right, should I go ahead and start?
Dr. Soul, you want to go ahead and start, sir? Uh, Ma'am, I would take that as a yes.
Okay. All right, good morning, everyone. I'm Arpita Lakhotia. Most of you know me. I'm assistant professor in child neurology at University of Louisville, Norton Children's Medical Group. I was asked to do grand rounds a short while ago, so this couldn't find a better topic than talking about social media for the neurologist. It's not really a long talk, so feel free to interrupt me as I'm going through the slides. I really don't have any disclosures related to this talk. I do moderate the EFL Child Neurology, which is the Child Neurology Residency Twitter account. This is the outline for the talk where I've got a couple of slides just outlining of what social media options are available these days. But there's a plethora, it's not even uh, an exhaustive list. And then mostly using the talk to discuss the platform Twitter as a tool, as a neurologist, that it can be used for things such as advocacy, education, as well as collaboration. Really, when you think about the common barriers to social media, up until now, we've had a bunch of issues why people are wary of using social media, especially in the professional setting. Most important reason that I feel is that it's lack of time. We all have 100 million things to do, and using social media as another option is just can be a whole lot. And there is a lot of information out there, so many social media options. So then, what would be the best option to use for in a professional setting? And in general, the perception of any form of social media over the years has been that it's meant for personal use, it's not meant for professional purposes. It's a frivolous thing to do, and only maybe vain people do it, or you're putting out a very positive persona, and that's what it's used for. Other reasons for lack of professional use is that there's always a risk for HIPAA violation, and then there can be concerns about professionalism depending on how things are used. A lot of people who did not grow up with technology certainly have technology phobia. There's all these options to use. What do we use? How do we use it? How does it even work? So really, it boils down to a question: what value does it bring to you? And I'll hopefully try to answer some of the questions from the standpoint of Twitter through this talk. And I was trying to make Poll Everywhere work on this, but I could not. So feel free to type other barriers in the chat that I didn't address here that you think are major barriers for you. I don't know how to see the chat though, so maybe I can look at it after as we answer questions. So in this day and age, why should we care about social media? Before the COVID-19 pandemic, social media channels were gaining traction as professional tools that a lot of physicians, including neurologists, use. Organizations such as AAN, AAP, all promote the use of social media in the professional setting. And there were a bunch of reasons for this. One is some of the mediums are easy to use, easy to collaborate with people across the nation, across the world, has a very wide outreach, whether it is reaching out to your colleagues or reaching out to patients or reaching out to the general public. Um, it can be a big tool for advocacy. For example, AAN promotes the use of Twitter and Instagram a lot when you do Neurology on the Hill. And actually, a lot of neurologists joined Twitter as they attended Neurology on the Hill over the years. It can be used for education, and I'll discuss that a little bit more in the talk. And then building brand recognition, whether that's at an organization level or at individual level. The more things like Twitter are used in the professional context, people do get to recognize your name, where you're working, and a lot of hospitals and organizations across the country are using it as that tool. Now, since the onset of the pandemic in the past year, it has basically become 10 times more useful, become much more relevant over the years. A lot of residency programs, neurology, child neurology, and across the board are using a lot of their social media tools for residency recruitment, mostly because it provides a nice virtual avenue into day-to-day life of the residency, how things are done, and what's going on. And both our child and adult neurology programs have used that a lot in the past year. And then in general, as conferences are virtual, as networking options have become more virtual over the past year, it is certainly very helpful for collaborating among professionals. I spelled that wrong. So just going over what options are there, if we, again, this is not even an exhaustive list. This is just a review of the common things that we think of when we think of social media. First is Twitter. I won't go into details of that here because that is really the rest of the talk. Instagram is something where you can post pictures and post a story with a picture and then uh, kind of build your presence there. I don't think a lot of neurologists are using that on an individual level, but it is certainly being used a lot from an organization or a program standpoint. So we have both U of L child neurology and an adult neurology Instagram. Um, Similarly, for organizations, they're also using Instagram a lot to promote their content and the work that they're doing. Facebook typically used for personal purposes, but there are subsets within using Facebook where it can be used in the professional context. There are a lot of groups and that are made up of physicians or neurologists or people with the same um, area that they practice in or same interests. And a lot of these groups are private, and people use those to network and collaborate, as well as run difficult cases, kind of like having colleagues basically across the world giving you your input. And I really want to highlight Women's Neurology Group, which is one of my favorite things on Facebook. Um, it's a group that was started by actually Dr. Catherine Lefevre, who used to be here a couple of years ago, along with a couple of her colleagues. And it's a wonderful avenue for just networking amongst women neurologists. And as part of that group, as you can see, it's a private group. It has almost 3,500 members from across the country, across the world, and people collaborate through WNG. They have been able to create a Women's and Neurology's AAN section. They've started a mentoring program. They run monthly CME, a virtual CME, and then just within the group, it can be used for collaborating with people, asking your questions, whether they're medical, non-medical, finding a neurologist, or even just running a difficult case by people. So just a really positive place where you can go to get more information and just network with people. At an organization level on Facebook, again, child neurology and adult neurology both have residency pages, which are somewhat robust, not quite as much. And then a lot of professional individuals create personal professional page, which is basically, for example, if I create a page, it would be Dr. Arpita Lakhotia or Arpita Lakhotia MD, and just open it to the public where people don't have to friend you, they just follow you, and then you post things about what you're doing professionally and sometimes used for public education and public health. Um, as far as I know, I don't think there are a lot of neurologists doing this. I do know of some neurologists who have a personal professional page. And then there are other social media avenues. People have blogs. Organizations have a lot of blogs. AHA, American Heart Association and Stroke Association run this stroke blog, which is a lot of times um, uh, the blogs are written by trainees. These are non-peer reviewed, obviously. Beyond the Channel is a really, really great blog that is actually run by a geneticist at Children's Hospital of Philadelphia. And he actually posts a lot of information about uh, neurogenetic stuff, and then has a lot of citations and references on there. So those are certainly something that can be used on the um, as social media again to disseminate information. There are podcasts, which are basically audio forms of blog, really, and there are a lot of podcasts out in the world, including 3 or 4 from the American Academy of Neurology as well. And then YouTube has been used by some organizations and individuals to disseminate information. If you look on YouTube, there's a lot of information about medical education and how to do procedures, how to just educating on things. UFL Neurology has a YouTube page where we post grand rounds typically, which again is helpful to disseminate that information. And then there is even more. So TikTok has become a newer platform, and honestly, I don't have a TikTok account because I'm a little bit older there. Very much popular in the younger generation. Typically not a professionally run account, but there are some physicians who use it to disseminate information to their patients or just the public, as well as for medical education. And then there are strictly professional sites such as LinkedIn and Doximity, which is specific for healthcare providers, which can be used to highlight, again, the work that you're doing, networking with people, collaborating with them. I have this video here from a person, I got it off of Twitter, but she's a neurologist who posts on TikTok about just little snippets of education.
This is a great question. The short answer is a TIA, or transient ischemic attack, is temporary, whereas a stroke is permanent. When somebody has a TIA, their symptoms are temporary and they end up going back to their pre-stroke state. All the symptoms they have completely disappear. Whereas someone who has a stroke, those symptoms will stay and they will last a long time. Sometimes they get better over time, and sometimes you do get back to your pre-stroke state, but the biggest difference is right here. With time on an imaging such as an MRI, you will actually see scars and lesions that show that there was damage to the brain. If someone has a TIA, you do not see any of these changes in their brain. Well, it's important to distinguish between the two. The more important thing is that you still treat with secondary stroke prevention so that you don't actually have a stroke or another stroke in the future.
As you could see, this was less than a minute long, but really summarized TIA versus stroke for a layperson who may be just looking for information. So certainly has its uses. It's just not as widespread amongst healthcare professionals at this time. Oops. All right, so moving on to Twitter, which is what I really want to talk about for the rest of this talk and how it can be used in the academic setting in medicine. So signing up for Twitter is really straightforward. You go to the website, click sign up. It asks you to fill your information and then verify a couple of things, phone number or email address. And then you can customize your account with a handle, which is really your username on Twitter, which is what people see, which is what you kind of stay with and use over time. And then add a photo to your profile as well as a bio. And bio could consist of really anything of what you do, what you care about, what you're passionate about. And then you just start following people and organizations of interest. It is different for people who've used Facebook. It is different from Facebook, where you have to friend a person to know more about them. Here, you can just follow anyone, similar a little bit to Instagram, where you just follow them and they may or may not follow you. It doesn't matter. You still get to see what they're posting on their feed. And then UFL has a Twitter account, AAN has a Twitter account. Most organizations these days, including healthcare organizations and education organizations, have a Twitter presence. So it is one of the most robust social media sites for advocacy and outreach. And the way that it works is it's a microblogging platform, meaning that there is a limit, character limit to each tweet. Each tweet, it used to be 140, now it's 280 character limit per tweet. But then, which you can create threads, basically linking one tweet to the other if you want to post a longer thing. But then having that 280 character limit really asks you to use your skills to be succinct and put that information in a short post rather than rambling on for paragraphs and paragraphs of things. And that's really helpful because all of us at this point have a short attention span. and you can get a lot of information out in that 280 character limit. And then you can follow people and organizations of interest. People follow you. And then again, because there's not that ask of making friends with people or joining the group or anything, you really can get a lot of outreach, and people from world over can follow you, or you can follow people and organizations from the world over. And then hashtags, which I have on the next slide, can be used to find stories of similar interest. So just looking at the bio for, say, U of L Child Neurology account, again, the U of L Child Neuro, at U of L Child Neuro is the Twitter handle or the Twitter name. And then the bio can be anything that you care about. And then you can link to a website, which can be your department, your organization, and then where you're at. So this is kind of what the header of a Twitter account looks like, or profile looks like. Hashtags, we use a lot of hashtags these days in a lot of social media platforms. They originated on Twitter, and it's basically the use of a pound sign before a word. And the value that it brings is that if you have a word with a hashtag, then you can click on that and it can bring you to other posts or other tweets that have similar hashtags. So for example, on the right, I basically typed NeuroTwitter, hashtag NeuroTwitter, and searched, and you can see posts from different people, really different things. Just the bottom line is that they all use the hashtag NeuroTwitter, and you can see a lot of tweets related to that. Some people do have issues with putting hashtags, but really the space should be after the word. There should be no space between the pound sign and the word that you're using to really make it searchable. And the way that you know that it's an appropriate hashtag is because it turns blue, at least on Twitter. And then when you look at this tweet from Continuum on that picture on the right, they not only used NeuroTwitter as a hashtag, they also use neurootology, neurology. So you really can put hashtags for things that you think are pertinent to that post or tweet, as well as dizziness is there. On Twitter, there are a lot of tags that can be followed. There's millions and millions. Some of the big ones that I follow are MedEd, NeuroTwitter, Neurology. There's NeuroTwitter Network, but you can go down that rabbit hole of finding lots of tags. AAN, every time they have a meeting, they have the hashtag AANAM, which when you click that, you can see everyone who posted a tweet with the hashtag AANAM in one list. And then it can be sorted based on what's the most popular tweet, so that you can see the more relevant tweets, or you can sort it by the latest tweet that was posted, but then you might have a lot of non-relevant things also. So this is an example of what a tweet normally looks like, somewhat of an anatomy of a tweet. So on the top, at Lakhotia Neuro is the handle or the name that I use, and then you basically type something, and things that you see here at KY Hands and Voices and at KY Gov are basically Twitter handles of Kentucky government and Kentucky Hands and Voices. So if you tag someone in a tweet, it shows up on their notifications, and then it brings that to attention. And then again, you can use hashtags to make it searchable from those standpoint. At the bottom of a tweet, you have how many people commented on it, or basically interacted from that standpoint. Retweet is basically if someone sees this tweet and you can retweet it to make it show up on your timeline or on your post. So then it goes to whoever retweets it, it goes to their followers also. And then people can like a tweet. So some of the uses of Twitter in neurology, as a neurologist that can be used is advocacy is a really big one. And like I said, AAN really promotes the use of Twitter, especially during neurology on the Hill as well as neurology off the Hill. On the top, you can see some of the photos from neurology on the Hill 2020, which and the Kentucky group from NOH 2020. And the middle tweet, you can see that they use the hashtag NOH 2020 AAN advocacy, which again, if you click NOH 2020, you can see all the tweets that were posted at that with that tag. Or if you click AAN advocacy, you can see all the tweets that were posted with that tag. Similarly, the screenshot on the right, you can tag people that are appropriate. For example, some of the senators that we met with, Rep. 2-3, and then you can tag the people that were on there or any relevant organization such as AAN member, which is the handle of American Academy of Neurology. On the left, you can see a tweet from University of Louisville, which was posted last year in relation to white coats for Black Lives. And at that point, when you click that hashtag white coats for Black Lives, you can actually see a whole stream of tweets from different organizations, different med schools and centers who participated in the demonstration. So it can really highlight things, because then your outreach becomes way wider than just your immediate followers. Because if anyone clicks on white coats for Black Lives, they can see all the relevant tweets from there. And it can, so for example, using it during Neurology on the Hill or similar events, it can be a direct way to contact your representatives or get in touch with them. It can be used to bring public attention to issues that are relevant to you. Again, some examples of advocacy. Neurology on the Hill is either for this year is virtual and is either this week or next week, but you can see people have already started posting things with NOH21 for this year. And then again, tagging AAN member Orly Avitzer, who's the president of AAN, as well as using the appropriate hashtags such as telehealth and COVID-19 recovery, which are really the advocacy points for this year, as well as using the tag AAN advocacy. So basically, the using hashtags is really up to you. Make them relevant to what the tweet is about, but it can help you get more outreach for what you're posting about. Again, organizations use it for advocacy. So you can see Cure Kids Stroke, which is the organization for International Pediatric Stroke Association, uses it to raise stroke awareness. People within the AAN sections use it for collaboration and awareness. Rare Disease Day was a hashtag that you can post on, again, bringing attention to rare diseases on February 28th. It's really a great avenue to follow conferences, whether or not you're attending those conferences in person or virtual. For example, AAN annual meeting always has the hashtag AANAM, and while AAN is going on, if you click on that hashtag, you can see all the tweets that were posted by that. And again, those can be sorted by the top tweets, which were the most popular tweets, versus the latest tweets. But you can get a lot of information related to that. Or on the left is someone who used the tag for International Stroke Conference 21, ISC 21, and then posted relevant material from there. So really, even if you're not attending a conference, by following some of these tags, you may get a lot of information from what other people are posting during those conferences. Certainly following journals can be a wealth of information, because again, most journals have a Twitter presence, and they'll post important papers as they get published on their Twitter. Sometimes they'll even post a summary or a journal club associated with that paper. And again, we all have a lot of avenues to access journals, read, just using PubMed, getting email listservs. This can just be an additional thing. And again, because it's in a micro-learning, micro-blogging platform, it might be something that if it catches your eye, then you go and read up more about that paper or more about that topic. We've used it a lot to highlight any symposia or any conferences that we have. So as you can see, U of L Neurology always posts, we post our grand rounds on there, and then using the appropriate tags as well as hashtags, get the right people involved. U of L Child Neurology has used our Twitter account for posting about all the annual symposia that we organize. And actually, I think using a lot of the social media, we were able to get even a lot of international presence at our Child Neurology update last year. And then microlearning. So microlearning really is just using that 280 character limit tweet to post important facts about a study or a paper, whether it's your paper or whether it's someone else's paper, and you're just sharing that information. So as you can see on the left, Dr. Feng posted a nice summary of what was posted in the Green Journal. And you can basically retweet it in a way where the original post is there from the Green Journal, and then she just added her bit to it, which can again amplify things. On the right is actually a tweet which I found very fascinating. Someone posted about this paper that was published about a case report with a 2-year-old with new onset epilepsy who had a de novo variant in SV2A and who actually developed status epilepticus when they received Keppra. And it was a paper written by this person, Daniel Kalame, and he just highlighted his own work and again used the appropriate tags with epilepsy, SV2A, and Keppra. But this is just someone that I follow on Twitter, and as it was one of those things that as I scrolled through it, I came across this and then went on to read the paper. Might have not actually come across this paper had I not been scrolling on Twitter in the real world. So it just gives you other opportunities to look up information. And then it can certainly be used to share your own work. A lot of people will post their research, including abstracts as well as papers, to Twitter to amplify that. And a lot of journals are using Altmetric, which uses Twitter shares also as one of the things, as well as Facebook shares. There are a lot of things that happen within Twitter that can be fairly useful. So one of them is Twitter chats, which are basically threads where people gather together at the same time as at a predetermined time and then discuss a certain topic. So for example, on the right is an example of MedEd chat, which is a lot of medical educators who get together, and the moderator, which is the MedEd chat person, really posts a topic 1, topic 2, and for example, on this screenshot, the topic was what are the unforeseen benefits of virtual educational conferences, and then people reply to it or retweet it with their inputs. So by using that MedEd chat tag, when you click on it, you can see a lot of the replies of what people have posted. And this is just one example. Typically, for example, MedEd chat is on, I think, Thursdays at 8 or 9 p.m. or one Thursday a month. And then they post 2 or 3 topics that go on for an hour, and then they discuss some of the pros and cons of things or discuss some of those topics. There are many other chats like this. This was just an example. And then a lot of societies or a lot of groups will host journal clubs. So you can find those related to your topic, and they work in a similar fashion where they will use an article and then at a predetermined time, they will, a lot of people get together and go through questions related to that paper, which is an example on the left. So there's Neurojournal Club, there's Neurocritical Care Journal Club, there's Pediatric ICU Journal Club, there's several of those. You just have to find them. Tweetorials. So tweetorials are some of my favorite things for medical education that can be done on Twitter. Dr. Berkowitz, whose screenshot is on the left, is actually does a lot of these and is really good at these. So for example, the screenshot that I used was he posted about CSVT, and the way tweetorials work is you pick a topic of interest that you're an expert or that you want to teach about, and because each tweet has a character limit, you create a thread of tweets just discussing that in a very, very simplified fashion. It's really great for trainees, medical students, as well as residents. So for example, he talked about CSVT when the Johnson & Johnson vaccine-related thrombosis came up. And then if you click on that show thread option after tweet, you can see the entire thread of tweets that was posted. And so what Twitter does is it summarizes, when you look at it in the first row, it summarizes it into a couple of tweets, but you can always click on that show thread to see all the tweets that were posted. And typically, a tweetorial might consist of anywhere between 3 to 5 to 10 or 15 tweets. But it provides a nice summary of any topic that someone chooses to post about. In the middle is an emergency medicine physician who posted a really nice tutorial for residents on how to develop good study habits. And again, if you can click on tweet, show this thread, and it'll show you all the tweets that were linked to one another that were posted within that tutorial. And I think it went on for a little bit. I only posted 2 or 3 of the tweets. Similarly, for UFL Child Neurology account, we do a Trivia Thursday where every Thursday we post a neurology question which may be relevant for med students or residents for their boards or otherwise. And sometimes it's a poll, sometimes it's a open-ended question. And after that, within the next week, we post the answer to that question along with a little tutorial where we'll post a little bit information about that topic. For example, this one was Friedreich's ataxia. And again, if you click on show this thread, it goes on into 5 or 6 tweets that go on that talk about Friedreich's ataxia and basically summarize it as a short topic. So you can create tutorials in whatever you're interested in, and if you make it simple enough and relevant enough, it can gain a lot of traction as well and can be a good tool for educating. Quizzes. So we, like I said, we use Trivia Thursday as a quiz format. Every Thursday we post a question and then have people respond to it. And we usually get a lot of replies to this. As you can see on this tweet, we had 24 replies. This was one of the more widely spread tutorial. And as people retweet it, it shows up on their timelines and then more people see it. On the right is someone who posted an infographic about Parkinsonism, and then this was used by one of our residents again for learning. So it certainly can be used to disseminate a lot of this information. So little snippets of information certainly is what Twitter is for. From this specific example of the Trivia Thursday, which gained a lot of traction, this was probably one of my favorite replies, is a random medical student somewhere in the US actually posted that by looking at the replies to our quiz, it helped her learn for study for her neuro exam in the week after. That was something really nice. So it certainly has that outreach. And this person, I don't even know if she actually followed our account or not. Again, example of snippets and quizzes. So on the left is someone just created a list of must-read papers for fellows related to pediatric related to neuro PICU. And they actually provided a link also of how to access this. But you can find a lot of similar lists of high-yield papers, high-yield information on Twitter if you follow the right people. The image on the right is one of my favorites. One of my favorites that I've found on Twitter was someone just created this diagram of CNS blood vessels and their territories, as well as strokes and what they would look like related to them. Simple context, but someone simplified it. And again, this is not a person that I would normally interact with or know about had it not been for Twitter. So just came across this because I was scrolling by and saw this tweet. So certainly you can see a lot of things which you might not normally come across because you're not working with those people. Similarly, there's a lot of world-class educators on Twitter. You can follow them and learn from them. And they've created, actually a bunch of them have created little series of talks and tutorials that they do on a predetermined basis. So Dr. Tracy Milligan is in Boston, and she started this Neurology Morning Report, which is once a month. She started during the COVID-19 pandemic, and it's a great educational tool for trainees. On the right is from Dr. Pisano, who I think on a weekly basis, or I guess on a daily basis, posts, or weekly basis, posts a EEG case of the day where there will be a snippet of question, and then the next tweet there's a picture of a EEG, and then people that are following her or who see the tweet reply to it, and then eventually the next day or so they post a reply to that with the answer and what's going on. They often have a lot of pediatric EEGs on there also. So again, that can be something that can be used to easily learn while you're just scrolling through some social media. Similarly, Twitter can, because it has such a big outreach, it can be a tool for finding out about symposia which you might not otherwise know about. For example, IAPS posted this during the Stroke Awareness Month, which is this month, about some of the talks that are available um, this month that can be accessed. Again, with the pandemic, everything going virtual, it's even easier to attend these talks. ICNA, which is International Child Neurology Association, uh, has education series that they do and they post on Twitter about it. I learned about the IGNA webinar through Twitter, and then once you register, you get emails, of course. But there are many other such webinars and talks that you can find through Twitter just because it's amplified a whole lot. Research and collaboration. On the left, you can see a tweet where someone who I follow, who I don't know in real life, just posted this survey that they're doing on Keppra use for specific syndromes in pediatric patients. And you can see that they tagged a bunch of neurologists and child neurologists on there so that it comes to their attention. So it did come to my attention, and then I was able to finish the survey and as well as tag a bunch of other people who did the survey. So you can easily see how this can be easily something that you're trying to do can be easily identified. And same thing, the other people that were tagged did the same. They did the survey and tagged 5 other people. So it was easily disseminated and done. On the middle is an example of an abstract that actually, it's a little meta. It came out of Twitter where this group of medical students created a Twitter handle, Twitter account, NMatch 2021, when everything went virtual during the pandemic. And they really used Twitter beautifully, where they collaborated and connected with medical students who were applying in adult or child neurology, and then used their Twitter account to amplify their voices, connect with them. And I think it was maybe through them that one of our residents, Grant Turek, was also invited to talk about our program and talk about child neurology. So they presented this at the AAN meeting this year, and this just highlights the power of how social media can be used to do good in medical education. On the right, again, is an example of research where Pediatric Neurocritical Care Group is collaborating with Neurocritical Care Society to get centers enrolled for some COVID-related research. Again, this is a non-education related example of collaboration that came across through Twitter. On the left is something called MedGrad Wish List, which was started by actually a child neurologist somewhere in the US earlier this year. And the whole idea was just celebrating underrepresented minorities in medicine who MS4s who are graduating this year, and just helping them out transition to residency. And it became a whole big thing where a lot of people contributed to the MedGrad wish list, and people would post their Amazon wish lists on there, and anyone who cared to buy could click on the hashtag, see the list, and buy things for those graduating students. It just became a really nice collaborative effort. On the right is an example of one of my other favorite collaborations that happened on Twitter. It was late last year around Christmas, where this physician who's a hematologist somewhere in the US started this HCW versus hunger hashtag. But basically, just with the pandemic, people losing their jobs and not having enough money, going hungry around the holidays, she started this thing where people got together and just contributed to their favorite food bank, and they even created a little competition where they had teams of neurologists, pediatricians, surgeons, anesthesiologists, and everything. And it became a leaderboard sort of a thing where they had a competition of who could donate more. And it wasn't even like they were collecting the funding. They just said, just donate to your any organization that fights hunger, and just show us the receipt, and it adds to your leaderboard. So just with that, just with the power of Twitter, you can see they raised over $250,000 in less than a week. which is pretty incredible. So this was my one of my favorite things in terms of collaboration through Twitter. Then you can certainly use Twitter to amplify your and your colleagues' work. On the left, you can see a post that highlighted an abstract that was presented by Jamie Shue at the Child Neurology Conference. And because of that, because we posted it on there, someone looked at the tweet, saw the abstract, and actually reached out to Jamie just to ask some questions, give some input. So certainly helped with collaboration, which may not have happened otherwise had we not posted it on Twitter. Similarly, on the right, just amplifying the work that other people are doing. Dr. Farber was involved in the study and it was published. So just highlighting the work that your colleagues are doing, Twitter can certainly be a place for that. And then highlighting the work in programs. Certainly, a lot of the institutions that have a Twitter presence are using it to highlight the work that their residents and trainees are doing overall. Whether they're presenting at national or international conferences, if they're publishing papers, we do the same thing in the UFL Child Neurology and Adult Neurology account. And again, in the virtual setting now, when people are not coming to Louisville to see our center, this can provide, again, an outlet of just showcasing the work that's being done. An example, again, if you're, despite the last one was more from a setting of a program standpoint, but also individual, like Rivaj posted about the paper that he was involved in. From an individual, from a clinical standpoint, you can certainly, with patient permission, post about patient snippets and outcomes and what was done at your center that was special, because that, again, helps with brand recognition, helps with getting the information out there of things that we are doing. I posted about this patient with SMA who was pre-symptomatically treated. A lot of the people who interacted with that tweet actually didn't even know that we were doing all these treatments here. Similarly, if someone was highlighted in the news, just posting that on your Twitter account, again, gets it an even bigger outreach. And then this was something where Dr. Puri was just playing with a child, playing baseball with a kid after a clinic, just posting this also highlights some of the things that you do or what your program is like. Same example, conferences that happen when Paul Gaunt presented one of his first conferences on the adult neurology side, just posting about that, hey, this is what we do, can be something that introduces your program to people, or posting about prior residents and things like that. This is, again, example of the same idea that just you can use it to highlight a lot of the things that you're doing, whether that's in a clinical setting or an educational setting. You can use it to highlight the city of Louisville, especially helpful for residency recruitment. We've done threads about lunch places, we've done threads about brunch places, done threads about where to live in Louisville, and those have been typically well received. So this is just an example. I did it as an experiment 2 days ago of Twitter outreach. On Tuesday, I posted this on Twitter asking people to just vote when they see a poll. And honestly, I don't even have that much of a following on Twitter. It's not like it's even in thousands, but you can see within 24 hours, there were 133 people who voted on this tweet. So it, again, can tell you that things can be amplified fairly quickly and fairly widely. So after all of this, some of the tips to get started on Twitter, really, it's just creating an account. The handle, if you put less letters on it, numbers on it, it has better recall. The simpler it is, you can use your name or you can use things that you like or really anything. It doesn't matter as much. Adding a photo, adding a bio to include things that you care about. For example, Dr. Feng here has a really nice bio where she's got a couple of tags of what she does, where she works at, what was she associated with, and the tags that she likes to follow or care about: neuroimmunology, MS, physician mom group, and women's neurology group. And a lot of people in the healthcare setting will put this disclaimer that tweets are my own and not my employer's, and they're not medical advice. And then you just start interacting with people. You can start following people and organizations of interest. I've listed some that I think are important. This is again not an exhaustive list by any means. You network with people. You just once you start following appropriate people, you basically your feed is going to look like who you follow. So you have to pick who you're going to follow to make it worth your time. And then you just amplify others and participate in discussions without getting into fights can certainly help build that following. And there's certainly the use of Twitter where you don't build a following, you just use Twitter to learn about things, to just gather all that information that I talked about. So there's different ways how it can be used, and it's really what you make of it. So some of the Twitter do's are really just finding things that you're passionate about and using Twitter to post about those or amplify those, because otherwise it'll become more of a task rather than something that adds value. So if there was one thing that you take away is tweet about things that you're passionate about. And then if you're someone who wants to develop a following, certainly generating useful content, whether that is related to education, advocacy, or outreach. These are some of the tags that are used for education, for neuroeducation that I've put on there. And these can be used to link content. And tweets should really be adding something to the conversation. Don't tweet just for the heck of it, just because it can be done. And most important thing is vetting the information before sharing. Do not share incorrect information. As a physician, you need to be a reliable source of information. Be professional, kind, and helpful. And some words of caution, it can certainly be overwhelming. It's like drinking from a fire hose with the information that is out there. Lack of time is certainly an issue, so you need to carve out time to use it. It can become a time suck if it is not managed appropriately. Remember HIPAA. Whenever you're posting a tweet, if a patient can look at if you think about it, if your patient can look at the tweet and identify themselves, you should probably change identifier and the timeline and things like that. So in neurology, a lot of us deal with rare disease. So if I see a patient with Duchenne today and post about Duchenne, hey, I saw a patient with Duchenne today, had this, then if they look at that tweet, they know what's happening. So a lot of people will wait maybe a month or two, change the age of the patient, change some of the story identifier if they're posting about a patient. Now, it's certainly okay if you have explicit permission to post on social media from the patient. So, for example, the tweet that I posted about my patient with SMA, I have permission from the family for the use for social media for that photo in the story. Things on the internet are forever, so think before you post. Know the guidelines for use of social media for your practice. At this point, most organizations do encourage the use of Twitter in the professional context, but they all have some guidelines that you should be aware of. Advocacy is appropriate, just don't get into unnecessary debates and fight. It is easy, it's just a written medium, so it's easy for your tone to be misinterpreted. So you need to be cautious about that. And again, can be a time suck if not managed. So you need to identify what your priorities are. So this is the summary of the whole talk, that it can be, lots of media options are available, can be used for a lot of things, can be used to learn and educate. Just need to use caution and be professional when these are being used. And that's it. And I'll end with this this video from Dr. Glaucleckin, who is on Twitter and also makes TikToks about neurology.
Hi, I'm the new meds. Hi, this is Neurology, returning page. Okay, so just so I understand, you're consulting me because the patient has a brain and you don't understand it. No, that's okay. Not everybody paid attention in med school. I tell you what, I'll let you know when I'm coming to see the patient. You can join me and I'll show you what a physical exam looks like. Oh, and if I see you checking reflexes with a stethoscope, I'm going to beat you to death with it. Yeah, okay. All right. Sorry about that. Oh, it's okay. I'm the new med student. Oh, welcome. Well, we got a couple consults to see this morning. This one is from a doctor who forgot how to take a history. And this one just says, MRI is broken. Okay. Well, do you have everything you need? Yep, ready to go. All right, let's go. Don't let other doctors push you around. They hate us because they ain't us.
Any questions?